Renata. I'll
Yep.
get people to give us a thumbs up if you want to use the reaction feature.
Yeah, okay, because I can't see when I'm projecting. So anyways, welcome everybody. Yes. It's March the 5th, it's Friday, it's noontime, and we're greatly appreciative for all of you who found the time in your calendar to join today. You'll notice that everybody's on mute. Of course, you couldn't respond to me, so we're on mute because there's a lot of people that have joined the webinar. So we greatly appreciate, again, the number of people who are on. And just to make things run a little bit more smoothly, you have been muted until the Q&A part comes up. There is a chat feature to ask questions. You can see on your screen, there's a little chat box. You can write your questions in the chat box. And Paula Smith is on the line, and welcome Paula as well. She's going to be taking your questions, and as well at the end of your the webinar, she'll also unmute and you can ask your questions directly. Also, we are recording the session and we've had permission from Vidge to do that, and it will be posted on the RTSO website afterwards. And again, thank you for all that you're doing. I did want to take a minute before I introduce Vidge and thank her for giving us her time today to share with us some tools on how we can support ourselves during this challenging period. But I did want to just take a minute to remind you that the RTSO is a volunteer organization. We're your voice in Ontario where you work. We're your advocates. And so this organization, we rely on two sources for revenue, primarily from memberships. Memberships are our #1 source of revenue. We also have corporate sponsors who we are truly grateful for their support. The last year was like a tsunami for everybody, regardless of which healthcare profession you were in, and also a good number of other essential workers, as well as all of us and our families. And now more than ever, we need your support for membership. Huge strides were made in the last 12 months, and I really want to give a shout out to the former board of directors and the executive, who many have left now and moved on, and we have a new board. And so I welcome all of them, but I really want to give a shout out to the people last year who really managed through this tsunami. And we have a chair at the table with the Ministry of Health. We have a chair at the table with the Coalition of Regulated Health Professionals. And we also have the support of a government relations and public affairs group who have been tremendous in supporting us. And through this last 12 months, we really have seen a huge amount of advocacy for our profession as respiratory therapists in the province. The group were able to advocate on our behalf for pandemic pay, for RTs to be at the front of the line for the COVID-19 vaccination, and most recently, even up to today, continuing to advocate for respiratory therapists to be included in job opportunities to vaccinate in the province. So stay tuned for more of that. But all of that to say that it's so important for you to be a member and to think about a membership if you're not already there. So for those of you who are members, thank you so much. For those of you who haven't yet taken the plunge, I really urge you to think about this as an investment in you. So again, thank you everybody for everything that you're doing. And again, a big shout out to the team from last year who really had a whole lot of work in front of them and took it on with stride. So you can go to the rtso.ca to join for renewing your membership before the end of March. So without further ado, I'm going to welcome Vidge. Vidge Richards is a registered psychotherapist. She's also a nurse, and that's primarily, Vidge is a registered nurse with a certification in occupational health. She has worked over 30 years in healthcare in the UK, in Europe, and in Canada. And when she returned to work in a hospital setting as an occupational health nurse in 2006, she wasn't prepared for the stories that she would hear around conflict, violence, workload stressors that staff needed help with. And she really didn't feel prepared in her own toolbox to support the staff. So she returned to school to become a registered psychotherapist, graduating in 2012 from the Transformational Arts College in Toronto. She now counsels the staff of a large community hospital, as well as having private practices in Milton, Guelph, and Georgetown. And as she contemplated her next chapter in life, she began to think of offering a book to help more people than she could in her one-on-one counseling sessions. And so Shift Stress was born and was self-published in November 2020. And you can see on the screen, I've put up a picture of shift stress. And she has published this book for healthcare workers, nurses, and other caregivers to support themselves while doing the work they love to do. So Vij is going to share with us a little bit of the learnings in the book. And she has also generously donated 5 e-copies of this book, which we will draw from our list of participants at the end of the session. So without further ado, I give you Vij, and I say thank you so much, Vij.
Oh, thank you so much, Renata, for that nice introduction and for helping to support my book. I think for RTs being on the front line, you know, you guys are on airway teams, and you are sincerely the heroes of, you know, who the communities are talking about, and so I'm here to remind you how important and valued you are in the roles that you play, and I think just showing up today is you know, what you're giving is to others, is being mindful about how can you give back to yourself, you know, in this difficult, stressful time. When I wrote that book in 2017, little did I know that it would be published in 2020, and so it's very timely for me to be able to go out and talk to the world about sharing the needs for healthcare workers to recognize we're human beings too, and it's so hard for us to, you know, to listen to the stories and then to be able to keep our masks on and to do the work that we do. And I think breaking down mental stigma and humanizing us as healthcare professionals is so needed. And so if we could put the slides up, I'll go through my presentation with you, what the agenda is, and then we can have some time left for Q&A at the end. And we'll just give this a moment. I hope this is interactive. If there's any questions that pop up, Renata, please interrupt me. And I'll give, you know, at each slide, I'll maybe just check in if people can raise a hand or how they do that. I'm not too familiar with this format on Teams work.
Vij, people can raise their hand and then they'll be given the opportunity to come off mute.
Okay, great. Okay. So is the slide deck coming up okay?
We can't see it. Renata, would you be able to bring it up and share your screen? Thank you for your patience, team. And I'd like to echo Renata's comments just with your thanks for your support. We are a volunteer organization and we're working furiously behind the scenes to, you know, advocate for our profession. And there are lots of moving pieces, but man, we've come through some really great challenges ahead of the game, and we just want to sincerely thank you for all of your support, your words of encouragement, for contacting the office and sharing your ideas. All of that just really helps guide us in our trajectory with the RTSO and improving our professional lives across Ontario. Take it away, Vij.
All righty. Okay. Well, maybe what we'd start with, because I do want some of this time to be actually experiencing some stress relief, and so not just talking about it. You know, I think we all know what it feels like. I don't need to tell you that, but I think just recognizing. So I just want to give a moment before we go to the agenda to do what I call an arrival practice. So feet on the ground, seat in your chair, hands can go up or down on your lap. And it's just arriving in this moment. You've probably come from busy schedules or with patients and coming from different walks, so that this arrival practice is just to allow you a moment or two just to notice where you are now in this seat and give yourself time to arrive. So closing your eyes or looking down softly at the ground in front of you and just taking a nice slow breath in and out. I like to count to 5, breathing in, 2, 3, 4, and 5, and out, 2, 3, 4, and 5, and in again, and out. And just letting your own body find its own natural rhythm. And just notice as you hear the title, Stress for Healthcare Providers, to support your resiliency. And just notice those words and what they mean to you. Just allow them to be there. To notice any thoughts or feelings coming up into your awareness. Not to change them at all, just to accept with no judgment. And offer yourself the intention of discovering what that could be for you in line with your quest for well-being. And coming back into the room. And that's a little arrival practice that I've started to do with a lot of my own meetings. As we're rushing through our days moment to moment, it just pushes the pause button for a moment just to connect. And here we are. And the next slide, please. And that should say shift stress, not stress for healthcare providers. I'm just noticing that. So I think Renata shared with you already on the agenda what inspired me to write the book, and so we'll go through a little bit about that. But just to recognize an ABC approach for self-care, and then I'm going to demonstrate the hand model of the brain about how our brains respond to stress, give you a good visualization on that, and then share with you 3 stress management strategies from my book. The acronym SHIFT is a reaction, going from a reaction to a response. And then this technique, an introduction to emotional freedom techniques. And then we'll end on a relaxation moment using a body scan. Next. The next slide, Paula. Or Renata. Thank you. So seeing the frustration at work when I first joined this organization was difficult for me to hear these stories. And much like you, where do these stories land with you? And you ruminate on them and you take them home. And so I felt inspired to learn about, more about human behavior and how we can cope with things. And as Renata was saying, I've been in healthcare for over, 30 years now, and it was the tools I hadn't learned in my healthcare profession. And so it was going back to school that I learned new skills and really took the time to find out more about myself, which, what was holding me back from sharing more with my responsibilities and how I could step up and make a difference, and what was holding me back. And when I learned ways to do that, it was so inspiring that I wanted to really share that more in my book. And EFT was the technique that helped me to get over my anxiety and to be able to have a voice in meetings and to share ideas where I would be more quiet and just listening and not be engaged. And so if this can inspire others to do that same work, I'm happy to do that. But first of all, we have to recognize our need for self-care. We're so in health as healthcare providers giving of ourselves that sometimes we don't recognize our limits And I think having awareness is the first step to that change. So awareness is recognizing when you look in the mirror, do you have the ability to keep on giving? And the balance is looking at ways you could recover from that. And then the connection is for connection and making a commitment to your own self-care. The next slide, please. So important to recognize with awareness, and those signs can come under physical. So who hasn't gone home with a headache or tension in the jaw or shoulders, muscle aches, upset stomach? Those are all physical signs, and on their own they may not be so meaningful, but when they're persisting, it's just interesting to take note of that. You know, spiritually and emotionally, there may be hopelessness, a loss of self-esteem, or lack of meaning and purpose. And so connecting to yourself, to listening to your own voice of what that means to you. Psychologically, it could mean distancing. You might be, you know, not connecting to your patients in the same way, or with co-workers, you know, whether there's guilt or shame coming up, or sadness and worry and anxiety. Some of the staff that I'm meeting for the first time have never been to therapy, and they've never had this experience of panic attacks and anxiety before this pandemic. And so they're judging themselves for feeling this way. And so I'm trying to normalize you know, that we're human, and these are some ways when we've reached our limits of how it shows up, and we're reacting to this abnormal situation that we find ourselves in. And behaviorally, you know, we get anger and irritation, and not being able to cope or do the things we want to in the same way. It's not as satisfying to do the care that we're doing when we're all masked and gowned up, and we can't see our patients the way that we want to connect with them. And so our decision making gets off, and we can increase, you know, drugs and alcohol, so that one glass of wine in the evening can turn to 2 and 3. So just watching all of these signs and what you're recognizing in yourself. On the next slide. And so I want to just show you the hand model of the brain, which is Dr. Dan Siegel's work. He's a UCLA professor, psychologist, and the neurobiological underpinnings of resilience are very dynamic and complex, and I'm sure you agree upon that. But our brain is the central organ responsible for interpreting stress, responding and adapting to our lived experiences, whether that's good or bad. It just takes data in and data out, and it processes information for potential threats and initiates appropriate responses for our survival. This is a leftover ancient part of our brain. So our brain and nervous system also learns how to respond to your beliefs that create these thoughts that then affect your mood and behavior. So it's so important to know how your nervous system is being affected by the work that you're doing. And I'm putting my hand up into the screen here so that you can see this demonstration. So Dan Siegel says our brains developed over 3 phases, and the first phase is the brain stem. So that's represented by my wrist, and then my hand is the head, and so this is my forehead here. So the brain stem was the first development of our brain, very much like animals, autonomic, and no control that we have. And the second part of the brain developed was the limbic system in the middle here. And my thumb is representing the amygdala that has, you know, 2 parts on either side. And this is our, like the smoke detector of the brain. So this information is coming in through all our senses, our eyes, our ears, our nose, our throat, taste, and touch. All this information comes into the amygdala and is recognized as a fear response. And if it's a repeated pattern, then touches into the hippocampus for learning that. So like in 0.8 of a second, you're having this information come through as a threat response, and your body's reacting before you have time to think about it as a way of survival. And the last part of our brain that got developed is the neocortex. So wrapping around that and touching into it, this is our frontal lobes. So as this is the executive thinking part of the brain, it is for our moral compass of right and wrong and creativity that makes us very different than from animals. But when we're under stress, the newer part of the brain literally gets hijacked and we flip our lids. And I think it's just a great visual to see, you know, in ancient times that was the stress response was meant for a short-term response to recover from a threat. But now in this world that we live in, we're constantly under threat, you know. It could be as simple as running a red light when you're late and we get stressed. It could be the deadlines. It could be, you know, too many overwhelming responses that you need to do at once. And so it goes on, you know, a relationship or an argument, and we're just constantly in this space. And when we don't think well. We don't make good decisions or rational ways of thinking. And so anything we can learn to keep that rational thinking brain online is going to be effective. And so I just wanted to show that as a visual, you know, especially if anybody has children, when you know that they're not responding well, they flip the lids literally, they're not listening, they can't hear or learn. And teachers are learning this, you know, techniques that I'm going to show you, the EFT, because it calms down the nervous system so that we can be prepared to show up and learn and be effective. And the next slide. Any questions there coming up? Just pausing. Any comments? Okay, so I'm going to go into the techniques. So the book that I wrote, Shift Stress, the acronym is SHIFT. And so the SHIFT stands for, S stands for sensations. So before we get any behavior changes, it always shows up as a sensation. And for people that are familiar with their systems, they will know that they feel, you know, an upset stomach or a tightness in the throat or clammy hands or something that tells them something's off in their environment, something's just happened. And so I just encourage you to become more familiar with your own system. So noticing those sensations is your first clue that something's wrong. And then the H stands for happening. So it could be what's happening internally, what's happening to trigger that sensation, or some external thing that's happened. Somebody said something to somebody that's happening. And so when you get that sensation, you check out what's happening, and then stop to inhale. The I stands for inhale. And when we take, you know, 3 to 5 breaths to slow down that 0.8 of a second reaction, we can get, you know, for 20 seconds, we can change and shift that reaction into a response. So taking that breath just slows us down. So the F in shift stands for focus. So then we can really think about, what is the outcome that I desire instead? What is it that I would prefer to have happen in this moment? And so when you're in those, you know, sometimes conversations that are difficult with people or patients, this is a helpful tool just to slow things down so you have a better outcome. And the T is for tracking, just tracking what's working, what isn't working. And slowly this can shift your response in time. So I just wanted to go over that. And I'm shifting very quickly through all of this because I'm just mindful of the time. But any questions about that? Pretty simple, right? Okay, we can go on to the next. So EFT is a evidence-based stress reduction technique that I write about. I'm an advanced practitioner in this technique, but I'm today going to teach you the bronze level of tapping because it's such an effective tool that uses our fingertips, and we can take this anywhere to help support ourselves. So it's based on Chinese meridian pathways. So as you know, they use needles to stimulate the meridian pathways in the body. And there's hundreds of points. But today I'm just going to teach you 8 of those points that are quite effective. And so we're talking as we're tapping. So we're targeting an emotion that can be negative. It can be anxiety or fear or phobia. I use it for trauma. It's very effective for PTSD. And with a practitioner, you wouldn't want to use anything with trauma and try to treat yourself with this, but to get some support. So the bronze level is just really tapping with no words. You can use these points and just tap and breathe. So if you're feeling anxious or anybody has panic attacks, you could just use these points and touch them, stimulating them, and breathing will calm down your nervous system. And the silver is about having some mindfulness about what you're using it for. And there's a ton of scripts online that you can pick up and use. So if you wanted a scripting for procrastination, for example, you could go on and find a script and just choose that tapping script. But the gold standard is working with somebody like myself who would personalize your anxiety. Anxiety or depression is such a big range of information, and everybody has a very unique story about how this is impacting them. So it would be your story that we're using to unfold it. What I also like about this tool is that the confidentiality. If there is a situation that people want to really distress about and share with me, but they don't want to share the details, you know your own details inside. You don't need to share that. And so we could call it a title without knowing all of that. And so let's go to the next slide. So these are the tapping points. And so at the bottom there, at the side of the hand, that's where we start and we target an emotion. So Renata has kindly offered to be my demonstrator. So I will work with Renata in this session. And then I would invite you all to join in with us. There is a thing called borrowing benefits, so that when I'm working with somebody and everybody joins in, there's an energy of support for that person. I actually did a tapping session with the Emerge staff this week, and they'd had a difficult case, and they all knew how to tap. And so, we took the details of what they were experiencing, and we did it together as a team, and it was so effective to be able to shift that energy and lower their, the stresses were like 7 and 8 out of 10 because it's measurable. And then they were able to return to work feeling a whole lot different than before they came in. So it's a measurable technique. So we're targeting the emotion first of all. And Renata, just if you can come in and take your speaker off. And we'd had a little conversation before about what we could use to demonstrate this to the group. And what were you saying, Renata, about the emotion that we could target today? Oh, yeah. Audio's up.
We've always got to unmute at some point in these webinars.
Yeah.
So, Vidge, what would you like me to share with you today?
Yeah, no, I was looking at having an emotion that we could target to use as a demonstration purposes, that people could just have a little practice with this in this session. So what were you thinking that we could use?
I have sadness.
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 Okay. Yeah. All right. Okay. So we've named the emotion, the sadness, and then we're going to rate it. So 0 meaning no sadness at all, and 10 meaning the most sadness you've ever experienced. What number would you put on that?
I'd probably say it's about 6.
6. Okay. 6 out of 10. And so I'm sure through all your experiences for folks on the call today, sadness is a pretty common emotion that we feel in the work that we do. So I hope this will be beneficial for all of us as we join in this together. So at the side of the hand, we do what's called a setup statement. So if you can see my hand in the screen, I'm a lefty, so I tend to use my fingers from my left hand going to my right. But if you're right-handed, you can go the opposite way, right? And so I'd say something like a setup statement that would say, even though I feel so sad, I accept myself and the way I feel. And we're tapping here as we're saying that statement. And we're doing it 3 times. But before we start, Renata, I'm just going to go through all the points first of all to go through them, okay? So that would be the setup statement. We've named the emotion. We've rated it 6 out of 10. And then we go to the first point at the beginning of the eyebrow, if you can see number 1 there. So we're just going to take 2 fingers and we're just stimulating the eyebrow at the beginning where the hairs meet. And you can just practice that with me as we go through these points. And we're just tapping about, you know, gently that we can feel it, but it's not hurting. We're saying, you know, all the sadness at the same time. And then we go to the side of the eye, on the bony point at the side of the eye, if you can see that point. Then we go underneath the eye, and that's in line with the pupil. This is the stomach meridian. So it actually goes across our face, around our ear, down the front of our body, and off our second toe. So I'm just pointing out that when we're tapping here, it actually is vibrating that whole pathway. So these 8 points that I'm teaching you vibrate the whole body. So even though we're using our fingertips on our upper body, it actually is transcending through the rest of our body. And it's very forgiving, so you can go left or right or both. You choose. Sometimes when I've done this with people that are angry and they want to rant and just get all the frustration and anger out there, they're doing, you know, both places. So whatever feels comfortable for you is good. So we're going underneath the nose and the chin. Here on the collarbone, I want to give you 3 choices. So if you can see the clavicle here, and just go down about 1 inch and across 1 inch, you'll feel the indent there in the ribs, right? You'll feel that notch there, that indent. So I think, am I sitting up high enough to see that across? So it's in that little groove there. So you can tap here. That's a K1 point. Or you can put a whole hand, it'll catch that meridian. Or some people like to put a fist there with a tie would sit on a man's tie. So all of you try those 3 points and decide when we get to that point what you like to do. Okay? You got your point, Renata, that you like to do? Mm. And you might find one of these 8 points really gives you a lot of relief, so that when you're in a stressful situation, that could be your go-to point. You know, you could very unobtrusively be in a situation where you can stimulate these points. And you do see people touching them, right? You do see people, you know, holding themselves in a way that, you know, could be supportive. They may not be aware of what they're doing subconsciously, but it's stimulating these points. Okay, and the next point is about 4 inches underneath the armpit. You can see the underarm position there. So that would be in line with the bra strap for women and in line with the nipple for men. That's a spleen point, a great point to stimulate if you're ever feeling under the weather or feeling ill. It's a good point to stimulate for your immune system. And the last point is on the top of the head, on the crown. So you're doing a little dance around or patting. So those are 2 choices. So you decide, Renata, when we get to that point, which would you like to do, a little patting around or dancing around there? Okay.
Mm-hmm. I'm curious to know from our participants too, who are trying these points, which ones are working best for you. I'd love to see your answers in chat.
Oh yeah, please do. I'd love to have some feedback too. So that's it in a nutshell. It looks ridiculous. I know you probably wouldn't want to do it out in public, but you know, in the privacy of your own home. And but I will show you. See on the hand, there is black dots there on the side of the fingernails. So those are also meridian pathways that you can, do very easily under a desk if you're in a meeting or, in a stressful situation. You can tap with a finger on the side of your nail beds or do it with your thumb, and that could be effective too.
We're getting some responses. So Jessica finds that around the eyes is where she's liking, and Sadia said side of the hand.
Oh, perfect. All right. So for people on the call, just think of your own stressor maybe, or if sadness isn't what's coming up for you, you could think of your own and put a number on there, 0 to 10. And then we're going to tap together with Renata, and then we're going to take a break and then just check in again. Okay?
So Mitch, I have a question for you. Yeah. Carolyn asked, how do we know what points help in which way?
Because you don't know where your disruption of energy has happened. So it's all the points need to be tapped. I'm just saying one of them may feel soothing to you. And so that's your own system that's responding that way. That as I'm going to demonstrate with Renata right now how we would use it. I'm putting all the pieces together now. Does that make sense?
Sounds great.
Okay.
Carolyn says thank you.
All right. How are you doing, Renata? You ready?
I am.
Okay. So side of the hand and everybody join in. I'm going to say the statement and then Renata, you echo and repeat it after me. Okay. So tapping on the side of your hand, even though I have all this sadness.
Even though I had all this sadness.
I accept myself and the way I feel.
I accept myself and the way I feel.
Good. And are we tapping at the same time, Renata? We're tapping on the side of your hand?
Yep.
I'm just looking good. Even though, and we're saying this 3 times, so even though I have all this sadness that's showing up.
Even though I have all this sadness that's showing up.
I accept myself and the way I feel.
I accept myself and the way I feel.
Good. Even though I have all this sadness.
Even though I have all this sadness.
I accept myself and the way I feel.
I accept myself and the way I feel.
Good. And can you share with us where you feel that sadness? Do you feel it anywhere in your body?
I feel it in my stomach.
In your stomach. All right. So we're taking 2 fingers and we're starting at the beginning of your eyebrow. All this sadness that I feel in my stomach.
All this sadness that I feel in my stomach.
Good. The side of your eye. I feel so sad.
I feel so sad.
Good. Underneath your eye. My stomach's telling me how sad I feel.
My stomach is telling me how sad I feel.
Good. Underneath your nose. All this sadness.
All this sadness.
And at your chin. It's so sad.
It's so sad.
And at your collarbone. Wherever spot you decided to pick on. All the sadness that's showing up.
All this sadness is showing up.
Good. Underneath your arm. All this sadness showing up in my stomach.
All this sadness showing up in my stomach.
Good. The top of your head. All this sadness that I have.
All this sadness that I have.
Yeah. And then take a breath. And then that's one complete round. And then I'm just going to check in. Sometimes, and I know it's brand new and everybody's trying it for the first time, but sometimes that number can go up because now we're tuned into the problem. It can stay the same or it can go lower. So there's no right or wrong answer here on how you're taking this in. Sometimes there can be images, there can be thoughts or other sensations that are happening. So I just stop to pause and just have some feedback here on what you are noticing.
It's interesting. You start to feel there's like a vibration. It's interesting. It's just subtle, but it's there.
Subtle, very subtle. Energy is very subtle. Yeah. And sometimes there can be new information. So I'm just opening up that as a possibility.
David, do you have a template or a tool where participants could use to guide them in the language and the reflections used while we're tapping? Is there a little guide? You know, you started off with the sadness, and then my stomach's telling me I'm feeling sadness. Just to get in the groove of the flow of how to communicate while we're doing this.
Well, I'm asking everybody to repeat with us. Is everybody working?
Right? Yes, absolutely. Okay.
Yeah. So this is a group. We're all working together. We're tapping together. We're saying the same things together, and just noticing for ourselves, how are we feeling as we're doing this work? Yeah. Sorry if that wasn't clear. Sorry.
No, absolutely very clear. Thank you.
Okay. So the sadness, Renata, are we still at the 6?
Maybe a little bit less, but maybe I would say in between 5 and 6.
Okay. And is there any new information that came up there?
I would say yes, because you're thinking about it, right? And you're thinking about what it is. Mm-hmm. What is the sadness? Why is the sadness, right?
Okay. So that's the question. Why is so? It's like the onion. So, you know, sometimes we feel things and we want to just avoid them or push them away. What this technique does is have a different conversation, and particularly with ourselves, that we can inquire, you know, and inquire that curiosity, but with compassion. And then it can unfold things in a safe way. So if we can't, let's do a couple more rounds here, Renata. I lost your picture there, but if you can hear me and the rest of the group, we're going to carry on and work with Renata and her sadness, and hopefully this will help you too. So at the beginning of your eyebrow, all this sadness that I'm feeling.
All this sadness that I'm feeling.
And at the side of your eye, I wonder why I'm feeling this sad.
I wonder why I'm feeling this sad.
And underneath your eye, I'm feeling it in my stomach.
I'm feeling it in my stomach.
And underneath your nose, I wonder why I'm dwelling on this sadness.
I wonder why I'm dwelling on this sadness.
And at your chin, I wonder what this sadness needs.
I wonder what this sadness means.
And at your collarbone, I wonder if my stomach could talk to me what it would want to say.
I wonder if my stomach could talk to me what it would want to say.
And underneath your arm, all this sadness that I feel.
All this sadness that I feel.
Good. On the top of your head. All this sadness in my stomach.
All this sadness in my stomach.
And let's take another breath. And checking in. And any new information this time.
The sadness, it's starting to be less. I would say I'm probably a 4.
Great, great. And is there any new information about this sadness? An understanding of it more, or?
Yeah, I think I do understand the sadness. I do.
Mm-hmm. And is it wanting anything different? Like if you could go towards wanting something different for yourself, what might that be?
I think it's dealing with it. Right? I think it's, yeah, because of this, it's been something that's been there for a while, and I think it's now bringing it forward to be able to manage it.
Okay, perfect. So let's do this, and let's do a couple of rounds on that then. All this sadness that's showing up.
All the sadness that's showing up.
Yeah, the side of your eye. I'm ready to start dealing with it now.
I'm ready to start dealing with it now.
Underneath your eye. I'm understanding what it's about now.
I'm understanding what it's about now.
And underneath your nose. And I'm ready to let go of some of this sadness.
And I'm ready to let go of some of this sadness.
And at your chin, I'm ready to deal with it.
I'm ready to deal with it.
And at your collarbone, and that feels good.
And that feels good.
And underneath your arm, I'm ready to deal with it now.
I'm ready to deal with it now.
And at the top of your head, all this sadness that's been going on.
All this sadness that's been going on.
And let's do one more round, the beginning of your eyebrow again. All this sadness in my stomach.
All this sadness in my stomach.
And at the side of your eye, all this sadness that's been there for a while.
All this sadness that's been there for a while.
And underneath your eye. I have better understanding of it now.
I have better understanding of it now.
And underneath your nose, and I'm ready to start dealing with it.
And I'm ready to start dealing with it.
And at your chin, and that feels good.
And that feels good.
And at your collarbone. Thank you for the sadness.
Thank you for the sadness.
And underneath your arm, for helping me deal with some worries that have been happening.
For helping me deal with some worries that have been happening.
And at the top of your head. And I'm ready to start dealing with it now.
And I'm ready to start dealing with it now.
Good, and take a breath there. So a 6 to a 4, and how are we doing there?
It works, Vidge. I mean, you start to, I think because you start to get into it, right? So you start to relax and you start to focus and you do start to feel. And I guess I'm wondering, like when you said, you did this with a group in the Emerge, is this the kind of exercise that you would do with them?
Oh,
Same
yeah.
kind of thing. Yeah.
Yeah. You would just accept where you're at right now. It's a horrible place to be in, right? And so we just accept, and it's just sharing it lets other people know I'm not the only one feeling this way. I'm having a difficult time right now, and so are other people that are sitting next to me. And we honor that. We open that conversation up, and we're honest about it. And then we tap on it, and we can watch. And when you reduce, even just we did like a few rounds there, to go from a 6 to a 4 is huge. It gives you more space to be able to focus, to breathe, to have a different outcome. It's so helpful to just, and that's what all we are is a brain and a nervous system as we go through this life and the challenges. And when we get dysregulated, we're not being, well to ourselves or to our patients or to the community or our families. And there's so much stress happening. And we know that 95% of, disease states are caused by stress. And so anything we can find, I just found myself as a therapist now that this is one of my go-to tools because it's such an quick and easy tool to learn and to share for yourself. The art of delivery from my end of it can be different for everybody, but for you doing it for yourself, because you all know your own stuff, you all know your own emotions, and to do it in your own mother tongue language and emotions can be very effective and healing.
Vidge, we're getting some feedback that Jessica agrees that around the eyes, is really working well. And I wonder if can some of us actually hold our sadness and energy in certain spots over others?
No, sadness is an emotion. It's just not in spots. It's about recognizing in your system there's an emotion there. And I should also say, I know when things are releasing, because sadness can cause tears. Any emotion can cause an emotional release. It's an emotionally focused therapy, and so crying releases, and so it's very releasing of that releases the stress, and so you can open up and move forward. Laughing releases energy, and also yawning. When you open your mouth and release that air coming out is releasing. Or have you ever felt like energy shifting in your body, you know, like little champagne bubbles, like kind of running up and down your energy? Some people feel that too. Those are all ways that I know you've shifted, as well as measuring the number. And what I like to do is get that number down, you know, best to get down to a 0, but a 1 or 2, then you can start installing positives. We can't lie to the body, and if that's where it's at, then I honor, you know, sometimes there's resistance. People don't want to go to a place that they're not ready to go, and so we say that's perfectly fine. Even though I have this resistance of going here right now, I'm not judging myself. I'm allowing this to be, and it's okay. And just honoring that, it just releases. When we can name things, it can shift the stress just by labeling it. When you have thoughts like, I'm feeling so anxious, it's just, instead of pushing it away, which was, you know, so used to doing, is counterintuitive, but to actually recognize these emotions and to name them, and then allow them, and then sit with them and reflect, and then that heart opens up to give you some wisdom. And everybody, I believe, has wisdom in their own system. So I don't give advice. I just allow people's own wisdom to surface. When you can shift all of this negative energy, then we all have this inner wisdom that we can tap into and know exactly what you need. And when you get clarity, the overwhelm is no longer available. You know, you don't get overwhelmed when you have clarity, but you have focus and you can move forward, you make better decisions, then you don't get overwhelmed. So it's getting all through this stuff to be able to function and do the best jobs that we love to do.
That's great, Vidge. We're getting some really great feedback. Jacqueline says she really likes the eyebrows and eyes, but one of our colleagues, Diane, had mentioned that the hand's a bit easier in public because often when messaging around the eyes, it might be perceived that we're you know, when we're being publicly viewed. And Jacqueline is feeling the energy and things that may be subtle for individuals, but she's really enjoying the feeling of togetherness when participating as a group. And I echo that comment. This is wonderful.
Nice. Yeah, it is. It's a very safe practice. How are you doing, Renata, with that last round? Are you still?
Yeah, I'm good. I like I said, all of a sudden you sort of you start to focus. So you're forcing, you know, you're forcing us to face things and then deal with them. And I think that that's hugely important. And all of a sudden you sort of start to feel it's just you start to feel relaxed, right?
Yeah.
Like you're accepting it and it's okay.
Yeah. It's a nice place to be for sure. Yeah. Well, they found under functional MRI that it actually puts the brakes on the sympathetic nervous system. And we know we have to be in parasympathetic for rest and digest, right, to be able to heal. And so whatever we can do to have a calmer state in our system will allow us to do that. Yeah.
Thank you, Vidge.
Okay. Well, then I would continue, you know, just doing that till you can get down to 2, and then you get more wisdom to be able to go forward. But yeah, thank you for being my demo there and supporting yourself for self-care. So let's end on a relaxation moment, and then if there's time for questions, I'm happy to stay on too. So let's feet on the ground. This is a body scan. Seat in the chair. Hands up or down on your lap. Closing your eyes. Taking a nice gentle breath in and out. And if thoughts come into your mind, just let them go by like clouds in the sky. No need to attach any meaning. We have 86,000 thoughts a day. It's only when we attach meaning that we get bogged down. So let them go by. Just 2 minutes to relax. And bring your attention to the top of your head and just notice what's in your experience right now. Is there any tension in the top of your head, the sides of your head, across your forehead? Can you soften and breathe into that area if needed? Bringing your attention down to your eyes, around your eyes. And just imagine if there's little hammocks behind your eyeballs so they can just rest in this moment. Bringing awareness down into your jaw. We hold so much tension there. Sometimes you can just open your mouth and close it just to feel that tension. And then relax it. You drop your tongue at the bottom of your mouth and let it relax. And soften and unhinge that jaw. Bringing attention to your neck and shoulders. Feeling any tension there. And take a breath into that area of your body if needed. Taking your attention down your arms, your hands, your fingers. Just rearranging your body in your chair to support yourself. Bringing awareness to the front of your body and the back, how it's supporting you in the chair. Just noticing how your breath is coming into your body. Do you feel the warmth of the air going in your nostrils? Do you feel the air going through your lungs as your lungs expand at the side of your body? Or do you feel your belly rising and falling? Just noticing how you're taking air in and out. Bringing your attention down into your hips. Noticing if there's any tightness or pain in that area, just to breathe into that area. Can you let go a little bit more and relax? Taking your attention down into your legs, your thighs, knees, calves, shins, ankles, feet, toes, and heels. And just feeling the ground beneath you supporting you. You know how that feels to be on solid ground. Just noticing the pressure. Notice your body now as you've given it the attention from the top of your head down to your toes. And feeling this calm state. That you can do this body scan anytime you need to in between patients. When you need to just have a reset, have a moment just to have for your own self-care. I'm just going to let you stay here for 30 seconds before we come back. And keeping your eyes closed, take another breath in. Just wiggling your toes and fingers, bring some circulation back into your body. And gently opening your eyes, looking left to right to orientate yourself back into the space you're in. Take that energy into the next part of your day, to where you need to go. And thank you so much for having me.
Thank you so much, Vidge. We really appreciated your time with us today. I think that, first of all, I appreciate everyone's patience as we were learning a new platform. And I think this was actually a perfect session to embark on this journey. And I certainly am taking away some tips leaving this. And I hope that the other folks who have joined us today also are taking tips away to help. Because many times, as you've mentioned several times through our work, we are in situations where we're saying, yikes, help. So I'm going to hand it over to Paula. And again, thank you so much, Vidge. Paula is going to draw for your books. And again, thank you for being so generous with us.
No, thank you.